Okay, so anticholinergic drugs. The main classification of anticholinergic drug is these are antimuscarinic, ganglionic blockers, and neuromuscular blockers. So when you are talking about anticholinergic drugs, that you have to remember what is the main classification. It is antimuscarinic, it is ganglionic blockers, and neuromuscular blockers. So this is basically antimuscarinic. It is going to block M receptors. In ganglionic blockers, it is going to block N receptors, and neuromuscular blockers, it is going to block NM receptors. So there are two classifications for neuromuscular blockers as well. There are depolarizing and non-depolarizing neuromuscular blockers. So first we have to talk about antimuscarinic drugs. The first drug that we are talking about is atropine. So the atropine, here I have put where it is act and what is the action. So these drugs is basically what is going to do is contralateral to the uh, cholinergic drugs. These are anticholinergic drugs. So they are going to do opposite of the cholinomimetics. So these are basically the antagonists. So first one is atropine. In the eye, atropine does is mydriasis. Mydriasis mean it's a dilation of pupils. Sometimes before eye surgeries we need that. In cholinergic agonist drugs, we talked that in acetylcholine or bethanacol, those drugs are going to contract the pupil muscle, and that pinpoint pupils. Okay, they will uh, contract the pupils. But atropine, what they does is they dilate the pupillary muscle. In the GI tract, they reduce GI motility. So we know the cholinomimetics will increase the motility. Here, this atropine will reduce the GI motility. In the heart, it is tachycardia, the opposite of the cholinomimetic drugs, and block salivation, sweating, secretions. So these are very important. So they inhibit the parasympathetic activity. So no sweating, no secretion. So it will cause dry mouth, dry skin, and it will cause increased temperature. We know that through sweating, the temperature is going to lose, but when there's no sweating, so internal temperature will be increased. So this is the basic principle. And next, the scopolamine used for motion sickness. You have to remember that this scopolamine is available in pharmacy as transdermal patches as well. If you are getting motion sickness due to vestibulocochlear nerve, irregular, um, irregular and long motions that you are getting from the motion sickness, as vomiting and everything. So if you want to reduce those, you could use scopolamine. Next, the ipratropium and tiotropium. Ipratropium and tiotropium used in bronchial asthma and COPD patient. In nowadays, usually we use for the asthma is beta 2 agonist, salbutamol, albuterol, terbutaline, salmeterol. But you could use these drugs as well, ipratropium and tiotropium, if those drugs are not available. Next is oxybutynin, tolterodine, and derifenacin used in overactive blood. So sometimes that sometimes your bladder is going to overact and you want to go to toilet every time, but some of these drugs that we use for specific indications to reduce this overacting bladder by these three drugs: oxybutynin, tolterodine, and derifenacin. So you have to remember, uh, at least oxybutynin, tolterodine. So these drugs will reduce the overacting the bladder. So next is benztropine trihexyphenidyl used in Parkinson. Nowadays also they use, but there are more advanced drugs that we use for the Parkinson's, but also as anticholinergic drugs. In Parkinson there is imbalance between acetylcholine dopamine. No, more acetylcholine and dopamine will be reduced. Of course, we could use levodopa, carbidopa, selegiline, rasagiline like drugs. But here we use also to decrease the acetylcholine by anticholinergic drugs. We use this benztropine and trihexyphenidyl uh, in Parkinson. So in Parkinson, you need to increase the level of the dopamine and decrease the acetylcholine. So for to decrease the acetylcholine, we use this anticholinergic drug benztropine and trihexyphenidyl. So what are the side effects? Dry as a bone. We know that we talked about this is reduce the secretion, sweating, salivation, lacrimation, everything. So skin is become dry. So no salivation means dry mouth and dry skin, and it will cause out as a whole. It is cause hypothermia. It is so it is so obvious, no? When there is no sweating, as I talked about earlier, that if there is no sweating, there is reduced way that heat could lost to the environment. So it will become hypothermic condition. And red as a beet, of course, it will cause tachycardia and red skin, peripheral vasodilation, and blind as a bat. Blind as a bat. For it will cause blurred vision. Blurred vision. There are historical story that ladies use these the natural ones. Uh, they thought these dilating pupils pronounce their beauty, but as a result they were blind. So it will cause blurred vision. And mad as a hatter, hallucination and delirium will be caused. And also urinary retention, very important. Urinary retention, we use those drugs to overactive bladder, so as a side effect you will get urinary retention. Okay. So contraindications, we don't use these drugs in infants, no, due to hypothermia. Infants temperature also they are also high because of the high metabolic activity. So when you are giving this anticholinergic drug, it will increase the severe hypothermia will rise, so infant could die. So we don't use those things. And in the glaucoma, we don't use because it will increase intraocular pressure. And also in benign prostate hypertrophy or benign prostate hyperplasia, what is happening is that due to benign prostate hyperplasia, it will um, uh, block that urinary way. So it is it is in the disease itself there will be urinary retention due to bladder, um, that urethra constriction. So when you are giving again these drugs, it will cause more urinary retention. So you can't give those anticholinergic drugs in benign prostatic hypertrophy. So important is atropine poisoning. Atropine poisoning. So atropine could be poison due to overdose. So in the antidote disease is pisostigmine. It is a cholinergic agonist. Cholinergic agonist. Okay, cholinergic agonist. Reversible indirect acting cholinergic agonist is pisostigmine. And also this is an antidote mainly, but we could use it. It is with gastric lavage and use activated charcoal to absorb atropine in the stomach.